Hello, everyone. So my case study that I chose to do today was on ischemic stroke. Patient profile. My patient's name is PP. She is 77 years old. She is female. Her height, she is 5'4". Her weight, she weighs 235 pounds. And BMI is 40.54. Her primary language is English. Cold status, no CPR. DNI. Allergies are aspirin, gluten meal, ibuprofen, NSAIDs, sulfa, wheat, and sulfa methozole. Chief complaint, new left-sided weakness. History of present illness, presented to ER with new left-sided weakness. Past medical history, reoccurrent ischemic stroke with hemorrhagic conversion, right upper lung mass, recent DVT of left upper extremity and left lower extremity, paroxysmal arterial fibrillation, hypertension, severe obesity, hyperlipidemia, and chronic kidney disease 3. Medications, currently on amiodarone, 200 milligrams, one tablet twice a day. Eliquis, 5 milligrams, one tablet twice a day. Amlodipine, 10 milligrams, one tablet daily. Lisopro, 10 milligrams, one tablet twice a day. Magnesium oxide, 200 milligrams, tablet twice, once a day. And then Protonix, 40 milligrams, one tablet twice a day. Next, Miralax packet powder, 17 grams daily. And then Senna, 8.6 to 50 milligrams, one tab or two tabs daily. And then oxycodone, 2.5 or 5 milligram tablets, depending on the pain, every 4 hours. And then next are as needed medication. So Tylenol, 975 milligrams tablets every 8 hours. And then as needed Zofran, 4 milligrams IV every 6 hours. Current vital signs, heart rate 67, blood pressure 145/67, respiratory rate 18, O2 94%, nasal cannula on 3 liters, and temperature 98.6. And I'm sorry, I forgot to grab the initial vital signs when the patient first got to the ER, so these are just current vital signs. Assessment, my patient was alert and orientated ×4, but they're at times forgetful. She also had trouble with speaking. And then on the NIH stroke scale baseline, she had partial hemanopia, normal symmetrical movements, motor arm, left arm drifts, right arm no drift, left leg some effort against gravity, right leg drift, limb ataxia absent, mild to moderate aphasia, dysphagia test passed. And then I also noticed that musculoskeletal was moderately impaired. Patient reports strange of speech improving slowly. All lung fields are diminished/clear. No shortness of breath, chest pain, or nausea or vomiting. Pain is a 5 out of 10 at head, which is just generalized and aching all over. She's a sister 2, and she needs help with feeding. Diagnostic findings. So first we have labs. Hemoglobin was 11.3. The normal range is 12.0 to 15.5. Hematocrit was 36.9%. Normal range is 36 to 46%. Platelet count is 227. Normal is 150 to 450. Red blood count is 3.92. Normal is 4.2 to 5.4. INR 1.77. And the normal is 0.8 to 1.2. PT is 20.8 seconds. Normal range is 11 to 13.5 seconds. PTT, 30 seconds. The normal range is 25 to 35 seconds. And then creatine, 1.5 milligrams. And then normal range is 0.6 to 1.2. And then GFR, 38. And then normal is greater than or equal to 90. BUN is 24.6. Normal is 7 to 20. Potassium is 3.9. And the normal range is 3.5 to 5.0. And then now on to the imaging. So MRI showed no new ischemic stroke or hemorrhage. And then right upper lobe chest CT and biopsy were insufficient for cancer diagnosis of the lung mass. So she needed to get a new sample. So next is nursing priority problems. So my patient is going to be a high fall risk related to the ischemic stroke, impaired mobility, musculoskeletal mildly impaired. She is a cis of 2. Next, she is a DVT risk related to recent DVT of left upper extremity and left lower extremity. She also had ischemic stroke, impaired mobility, musculoskeletal mildly impaired, and she's also a cis of 2. She's not moving around a lot. And the third nursing priority is impaired gas exchange as related to 94% O2 on 3 liters and diminished breath sounds. Next is nursing interventions. So the first nursing intervention you want to do for my client is improving mobility by physical activity. American Stroke Association, physical activity improves overall stroke recovery and improves physical functions such as mobility, walking, and balance. Also improves mental function such as mood and reduces the risk of stroke recurrence. And furthermore, it reduces heart-related conditions such as blood pressure and reduces falls. The next nursing intervention is preventing DVTs. Centers for Disease Control and Prevention. To prevent DVT, the patient needs to improve blood flow by regular movement, such as wearing compression stockings and following doctor prescribes anticoagulations and moving around. The next nursing intervention is to implement fall prevention measures. Mayo Clinic, make an appointment with your healthcare provider to review side effects and medications that increase your risk of falling. Discuss any previous falls and your health conditions to form a plan. Involve physical activity to improve strength, balance, coordination, and flexibility. Furthermore, wear non-skid shoes or socks to prevent falls and remove any hazards that can trip you, such as electrical cords and the walkways. The next two nursing interventions are position the patient in semi-followers or high followers position, National Library of Medicine. Repositioning the client's head of bed at 60 to 90 degrees improves oxygenation by using gravity to lower the diaphragm, which reduces abdominal pressure on the chest, which allows for maximal lung expansion. This allows for easier breathing, reduces respiratory workload, and crucial for treating cardiac issues as well, which my patient has. And the last nursing intervention is ischemic stroke patients should have their O2 be between 95 to 98%. Ischemic stroke patients should have their O2 be between 95 and 98% because when an ischemic stroke happens, part of the brain has reduced blood flow, so it needs more oxygen. Next is interpersonal collaboration. So for my patient, they're going to need a primary care provider, a physical therapist, occupational therapist, a speech therapist, and social worker. Patient outcome. After 12 hours, the client participated in tolerable physical activity and is now wearing compression stockings and has been taking anticoagulants. The client is also tolerating semi-flawless position with an increased O2 sat to 95%. The client is doing well with these interventions and is showing no more signs of further distress. 5 key takeaways for me. So my first key takeaway is I didn't realize how much daily physical activity plays such a crucial role in our lives. Daily physical activity can prevent so many health issues. The second key takeaway is ischemic strokes significantly increase the risk of developing DVTs. My third key takeaway is you want ischemic stroke patients to have an O2 of 95% to 98% because an ischemic stroke reduces blood flow, so the patient needs more oxygen. And realizing to be grateful for the things I have because I cannot imagine having trouble speaking and what I want to say does not come out, but I know it. I know the word, I know what's happening, but I just can't explain it. And then my fifth key takeaway is I was surprised how many factors go into fall prevention measures. Next are 2 organizational policies. So the first policy at the University of Minnesota Health Fairview. An organization policy for Fairview hospitals is that if a patient is suspected of a stroke, immediate CT imaging and collaboration with neurointerventional teams will take place, and they get first priority for CT imaging. The second organization policy for Fairview hospitals is that they have an acute stroke team, which is a dedicated team available to give quick assessment and care to patients that are currently having a stroke. These are my references, and thank you for watching.